Policymaking for the legalization of marijuana in the state of Illinois. I chose this topic because I currently live in Illinois, and this is a policy that's going to be affecting us in the next 6 months. Did you know that 1 in 7 Americans have admitted to using marijuana at least once in their lifetime? Some individuals use marijuana for its pleasurable high, while others have found its medical use to be quite beneficial compared to other prescription drugs. Marijuana has a vast number of slang terms and can be commonly referred to as cannabis, weed, pot, grass, bud, and Mary Jane, and many more. It is a plant that consists of greenish-gray dried flowers of cannabis, and the plant itself can grow up to 16 feet tall. It can be grown in a variety of climates due to the diversity of its genetics, where sativas with the airy bud structure can tolerate hotter, more humid climates, while indicas grow denser buds as a protection against colder elements. There have been recorded over 3 million marijuana plants found in national forests throughout the United States today. The idea of legalizing marijuana has come to a shock to most individuals, particularly the older generation that grew up during the presidency of Richard Nixon and his war on drugs in 1971. During Nixon's presidency, people claimed there were two main enemies, the anti-war left and African Americans. Some believe that the war on drugs was to target the African Americans. President Nixon could not simply make it illegal to be against the war of them, but by getting the public to associate the African Americans with marijuana and heavily criminalize it, he could disrupt those communities. Therefore, Nixon increased the size and presence of federal drug control agencies dramatically and heavily pushed measures such as mandatory sentences and no-knock warrants. He declared that the drug abuse was public enemy number one and was a symbol of the youth's rebellion, social upheaval, and political dissent. He placed marijuana in Schedule I drug category, which is the highest potential for drug abuse. This gave the government the right to arrest the leaders, raid their homes, interfere with meetings, and slander their name to the public. Today, politicians have now admitted to having used marijuana when they were younger. President Barack Obama honestly admitted to his prior cocaine and marijuana use, stating, "When I was a kid, I inhaled frequently. That was the point." This has shifted the public opinion dramatically to favor the expansion of drug health approaches while reducing the criminalization on drug policies. Unlike alcohol, excessive marijuana smoking has not been straight out implicated in violent behavior or poor health. In fact, the use of medical marijuana has been proven to reduce anxiety, pain control, muscle spasms, nerve pain, nausea from cancer, chemotherapy, and seizure disorders. In particular, marijuana seems to ease the pain of multiple sclerosis and nerve pain overall. This area of pain has very few other options, and those that do not have extreme health risks such as Lyrica or opioids that are highly sedative. Patients claim that marijuana allows them to resume their previous activities without feeling completely out of it and disengaged. This medical use has given patients a much safer way to deal with the pain symptoms instead of the use of opioids, which are extremely addictive. In order for patients to legally obtain this drug, they must live in a state where it's legal and can be recommended by a licensed doctor. Licensed doctors can recommend and guide patients to acquiring a medical card, which also allows patients to buy marijuana from authorized sellers called dispensaries. Licensed dispensaries are required to have their products tested for potency in state-accredited laboratories before approval. The bottom line is that the medical use for marijuana is still fairly new to science, and we do not know the long-term effects it will have on our nation. Currently, the harmful effects that we have seen on the body have been found in consistent smokers are on the brain and lungs. Brain imaging scans of heavy marijuana smokers have revealed changes in blood flow to parts of the brain involving our memory and attention. The lungs can also be affected by long-term smoke inhalation with signs of damage and precancerous changes. This is because the most common way to ingest marijuana is through smoking. The idea of legalization of marijuana has come to a shock to most individuals. Currently on the state level, legalized recreational marijuana is available in 11 states, while medical marijuana is present in 33 states total. It is still illegal for the federal government perspective, but about 85% of Americans support legalizing medical marijuana, and it is estimated that at least several million Americans currently use it. The government continues to keep marijuana on the Schedule I drug category, but many Americans believe that marijuana does not meet the Controlled Substance Act criteria for this placement. This classification is due to the lack of research that has been done on the substance. Illinois is the 11th state to legalize recreational marijuana usage, signed by Governor Pritzker. Illinois became the first state legislature to pass a bill legalizing the possession and commercial sale of marijuana, while 10 other states did without a ballot initiative. The voting consisted of a bipartisan vote, meaning that both the Democratic and Republican Party found common ground through compromise to pass the bill through legislation. The Illinois House gave way to a 66-47 vote in favor, and the Senate passed the measure earlier with a vote of 38-17 in favor. Democratic Senator Heather Steens has been a recognizable leader in the efforts to legalize marijuana, stating that the 2 years of negotiation and study that went into crafting the legalization resulted in a bill that makes sense here for Illinois and will establish the new gold standard for doing this in the right social justice way. The House bill will allow Illinois residents who are 21 years or older to possess up to 30 grams of cannabis flower, 5 grams of cannabis concentrate, and 50 milligrams of THC. Part of the compromise insisted of restricting home growing of the plant to only medical patients with up to 5 plants per patient. Marijuana will be sold at state licensed dispensaries, and cultivation centers will also need licenses to grow the plant. Local towns and municipals will be allowed to enact zoning ordinances pertaining to public consumption. These enactments are scheduled to take effect January 1st, 2020. Illinois will also create a new tax program to impose a tax on the sale of marijuana in 2020. At the whole state level, marijuana products will be taxed at 7% when they are sold by cultivation centers or local farmers. At the retail level, Illinois will be taking a different approach. Instead of an overall tax on all marijuana products, Illinois will charge a tax based on the THC potency in the product. Products with less than 35% will be taxed at 10%. Products infused with marijuana will have a 20% tax, and products greater than 35% THC potency will have a 25% tax. The range customers will pay are predicted to be between 19% to 35%. Retail tax depending on the product's potency. The revenue from the sizable tax rate will be used to decrease the $133.5 billion pension hole Illinois is facing. About 35% of marijuana taxes will go to the state's general fund, 10% will go to another budget to help stabilize the program, 25% will go to the grant program to help the minority communities affected by the war on drugs, 20% will be used for the treatment of mental health and substance abuse, while the remaining 10% will be given to Illinois law enforcement to aid in the drug treatment education programs. During this transition, applications will begin in October 2019 for up to 75 marijuana dispensaries for new businesses. The current medical marijuana dispensaries will cultivate and provide to consumers over the age of 21 until the additional licenses are approved. By March 2020, Illinois will begin receiving and processing new license applications that will be issued in May of 2020. During this time, the state will need a market study of the marijuana industry so they can determine if the additional licenses are needed. Some challenges that Illinois may face during this implementation are how employees will manage their workplace drug policies and law enforcement's response to legalization. With marijuana becoming a lawful product, the Illinois Rights of Privacy Act will bar discrimination against employees using the lawful product off company time and property. This act will cause multiple problems for employers, such as permitting them to discipline employees who appear to be impaired outside of work and prohibiting them to discriminate against applicants who fail the drug test. Employers will no longer be able to drug test employees or applicants for marijuana beginning of 2020, unless the employer can prove that the employee was impaired at work. This means that employers will be limited to reasonable suspicion drug testing for marijuana. The act is unclear about what employers can offer to employees when there's reasonable suspicion of being under the influence at work, with most drug tests unable to pinpoint exactly when or where an individual used marijuana. The most commonly distributed drug test by employers is through urine, which can detect marijuana for up to the past 2 weeks. Hair tests can also be used to detect marijuana within the past 90 days. Since drug tests cannot detect current marijuana usage, employers will be prohibited by the Illinois Right to Privacy Act from taking adverse actions to positive marijuana drug test results in most situations, except for reasonable suspicion. Another main concern is the increased traffic accidents and fatalities that would be caused by drivers under the influence of marijuana. Law enforcement groups such as the Illinois Sheriff Association fought strongly against the legalization with the fear of increased DUIs. The state police have already begun making preparations by researching saliva-based THC testing, training cadets on advanced roadside impairment driving enforcement, and increasing the number of drug recognition experts on patrol. Despite these acts of prevention, it has become difficult to find any easy test to determine if someone is under the influence while controlling a motorized vehicle. The state statute has made some general provisions that an individual cannot drive a vehicle under the drug that renders the person incapable of driving. In a criminal or civil trial, it shall be presumed that the person was under the influence of cannabis if a whole blood test detects a THC consumption of 5 grams or more. For individuals less than that amount, the person is deemed to be not under the influence of marijuana. Senator Heather Steen has argued against this by stating, "The thing we have to remember is with cannabis legalization, usage doesn't change very significantly. The same population that's using now is by and large the same population that's going to be using after January 1st, 2020. So we're just giving more tools for law enforcement to use." The legalization of marijuana at the state level has been evolving and spreading to more and more states. Whether the pros outweigh the cons of legalizing marijuana, Illinois will face a monumental change of this health policy's implementation on January 1st, 2020. Thanks for listening.